Health officials are sounding the alarm as norovirus cases surge. What you need to know to stay safe from this highly contagious stomach bug. Joining us this morning to tell us more, Dr. Ulysses Wu, Chief Epidemiologist at Hartford Healthcare. Doctor, good morning. So glad you could be with us here.
Thank you for having me again.
Of course, a mom of two kids, I'm a little worried about the subject we're talking about here. This is like when stress really spikes around this time of year, especially. Can you talk to us about this virus that's starting to go around? What are some common signs and symptoms that it could be norovirus?
Yeah, unfortunately, there are a lot of viruses that can present very similarly. And so the fortunate thing is that they're all fairly treated the same, but some of the signs and symptoms, especially this time of year, there is a seasonality to norovirus and does tend to spike in the winter months, but does happen year round. You'll typically see maybe some fever, nausea, vomiting, and diarrhea. But it can be, that's when it's mild, but the more severe it gets, the worse the nausea and vomiting get, the inability to eat, the headaches, the fever, you may have some muscle pain, you just feel bad. What they typically would say like a flu-like illness, even though it's not the flu.
And how does it actually spread so quickly? And I know that this is very hard to contain once it's in your house. So how is this spreading? Can you help us with that?
Yeah, so the first thing about the virus itself is it can survive for quite a bit of time on surfaces. And that's why you hear about these outbreaks in community settings where there's a lot of cohorting of people. Cruise ships is the one that always gets the news. And so you can imagine it spreads very rapidly because it will survive on those surfaces for quite some time. In addition, it's pretty hardy. And so that means common disinfectants may not work against it. And so you really have to use stronger disinfectants, bleach, things like that. And then finally, the reason why it spreads so quickly is when it happens in the winter, people are clustered together, and it takes what we call low inoculum. And so it doesn't take a lot of virus to make somebody sick. And that's why this happens so quickly and spreads so fast.
Some of these can be really violent on someone, or even a child, or perhaps an older adult. When do you know that you might need hospital attention or medical attention?
Yeah, so we do worry about it in the extremes of age, and it really depends on the symptoms. So things like if they cannot voice their complaints to you, then you have to look for things like the inability to eat, or they've stopped urinating, or they're having massive amounts of diarrhea or nausea and vomiting where they are clearly dehydrated. For an older person, they may feel dizzy when they stand up, their blood pressure may be low. And that can also happen in kids as well. So these are some of the signs and symptoms that we certainly look for, that they are progressing through their illness.
Yeah, it is brutal. Now, you mentioned cleaning with very strong cleaning materials. What other steps can families and care facilities take to reduce their risk of an outbreak?
So I say this for almost all infectious illnesses. If you are sick, try not to get other people sick. That means you try to stay out of work or try to keep your kids out of school. I know that is not possible for everybody. And if that is not the case, then you want to limit transmission. So respiratory viruses, you want to do things like masking. But with diarrheal illnesses, especially people who work in the food industry, you kind of got to stay out of work. For those not in the food industry, wash hands with hot, warm water. You got to sing that birthday song twice. You can't just, I've seen it in the public restrooms where somebody will just wave their hands at the sink. That doesn't work. You got to actually wash your hands with soap and water.
All right, great advice. Dr. Ulysses Wu, Hartford Healthcare. Thank you so much for your time today. Hope you have a healthy holiday season. Thank you for your tips.
Thank you for having me again.